Today on Vital Insights.
Something that I think is really important for us as an association and as a country is to say, how are we going to use telehealth and technology to address these issues of access and ensuring that people get care where and when they need it, and that when they do, they know it's safe, effective, and appropriate, while enabling clinicians to do more good for more people.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. The American Telemedicine Association, or ATA, has been at the forefront of the advocacy for and advancement of telemedicine, telehealth, and other virtual care technologies since its inception nearly 3 decades ago. Our next guest had the unique opportunity to take the helm of the organization before the pandemic and has expertly navigated the immense challenge to ensure the members of the organization were represented and supported over the past 18 months. Mond Johnson joins us today as the CEO of the ATA, the only organization completely focused on advancing telehealth. Welcome to Vital Insights, Anne.
Thank you so much. It's great to be with you.
And it's great to have you with us. And you are joining us fresh off the heels of the first annual Telehealth Awareness Week. Congratulations.
Thank you.
So let's talk through it. Are there some broader components you're particularly proud of? Any anecdotal evidence of high points that you'd like to share?
Well, it was really a terrific showing for telehealth and how important it is. We launched it in April earlier this year and did it in conjunction with a campaign that we were running with a group of our members on ensuring that the waivers and the legislation that we had, that are the emergency orders and so forth that we had that allowed for the uptake in telehealth to really accelerate. And what was really wonderful about it was that we had such strong support, and we were able to corral such strong support across the board in a very short period of time. So I think that was really part of the highlight. The second is that we've always said that telehealth is a bipartisan issue, and it was. I mean, we had a number of states that issued proclamations supporting Telehealth Awareness Week, and then we had literally dozens of congressional representatives and senators who at the federal level also signed on for Telehealth Awareness Week. So it was really fantastic. And then the affiliations that we had with patient organizations like the National Organization for Rare Diseases and ALS Foundation and Susan Komen and the Mental Health Association of America. I mean, these were all organizations that came together and said, yes, we want telehealth to stay. You cannot take away this modality of care from us.
Wow. That's pretty incredible.
Mm-hmm.
Okay, so I'm going to ask you a tough question, which is there anything you would change for next year?
Well, I think we will, you'll see a lot more advanced work on it. So as I said, we launched in April in conjunction with our policy work that we were organizing with a group of members. And so we're already deep into that. And so we'll just start earlier and do even more. The other thing that we're doing is the ATA board recently approved the formation of a 501c6. So
okay.
ATA is a C3, and we have certain limitations in terms of what we can do on policy and advocacy as a percentage of our revenue. And we've now been working at the federal and state level for 2 years.
Okay.
And realized that as much as we hope telehealth is going to remain permanent, there's just a lot more for us to do. So we are going to announce ATA Action, which is really terrific. And again, that's going to help support what we're doing on the policy and advocacy front. And we'll all be part and parcel of Telehealth Awareness Week.
Oh my gosh, that's going to be really exciting. I can't wait. You touched on this a little bit when we were talking offline, but in what ways do you feel the pandemic played a role in the embrace of Telehealth Awareness Week, or maybe just advance the awareness of it? I guess that's pun intended.
No, that's fine. That's fine. And, you know, we were talking a little bit about when I joined the ATA, which was the beginning of 2018, so pre-pandemic. And at that time, the organization, which had been around for 25 years, had really talked about telehealth, and it was founded by the academicians, the clinicians, the folks who really created the industry.
Yeah.
But it didn't have a lot of broad-based support or appeal for people, and they didn't understand how telehealth fit into their lives. And so we really focused initially on dispelling myths associated with telehealth, that somehow it's second-class medicine, or somehow there's something inherently better about being face-to-face. We talked instead about how we really have problems with access in this country.
Yeah.
And there are literally over 50% of counties in the U.S. don't have mental health services, or didn't at that time, and in person, and yet 1 out of 5 Americans have a mental health issue. Pre-pandemic, we know that's higher now. And so if you are confronted with a aging population that's increasingly sick, and a uneven distribution of resources, and an inadequate workforce to deal with all of that, and plus we just had so many issues with ensuring that consistent quality medicine was made available to all Americans, that was really something that we knew telehealth and really technology writ large could address. And so our message really got accelerated with the pandemic. And the most important thing was that prior to the pandemic, engagement and adoption by both consumers and clinicians was fairly low of telehealth.
Yep.
And so what you know from a consumer goods perspective is that if you try something, you're going to have a higher likelihood of reusing it if you liked it. And lo and behold, people tried it and they liked it. So on the part of both consumers and clinicians, I think it's important to note. So that was really phenomenal in terms of accelerating the uptake and the speed of innovation that we saw. So really literally apps or consumer-facing platforms that would make it very easy for you to go online and say, well, here are my symptoms, and what should I do? Is that watchful waiting, or should I go to the ER right now, or what should I do? Because there wasn't enough guidance from a national perspective,
right,
or from a federal perspective or local level on what you should do. And so that was really important as well, that people were able to get answers, they could stay safe. We also saw a huge emergence of remote monitoring. And
yes.
That has been phenomenal in terms of its ability to allow physicians to what's called practice at the top of their license. So one physician cannot, keep their eyes on dozens of patients at the same time. But with remote monitoring and with this ability to create a dashboard and really look for signals of something not going well, then you have that ability to really enable clinicians to intervene when they should intervene, as opposed to trying to scan all the time.
Right, absolutely. I always say that's kind of like taking the issue further upstream, so you address issues before they actually become necessary interventions.
Right, exactly.
So something that you said that I would love to delve into, you talked about increasing access of care and care equity. We've seen a lot of that covered this week at Health, actually. Talk a little bit about what the work that you're doing and how that's advancing that as an initiative.
It's a great question. I'm always happy to talk about it.
I'm glad I asked that.
Yeah, thank you. So we have 3 key initiatives that we're working on at the ATA. One is to ensure that telehealth is not viewed as a pandemic-only tool. And so that's the policy and advocacy work, that's Telehealth Awareness Week, really elevating the conversation on how important it is to maintain access to this modality of care. The second thing that we've been focused on is operationalizing hybrid. And what I mean by that is, telehealth, virtual services are not for everyone or for everything. And so how do you identify the use cases? How do you take a patient from point A to point B in the most expedient fashion for both themselves as well as the clinicians? So that's the second thing. And then the third is something that I think is really important for us as an association and as a country, is to say, how are we going to use telehealth and technology to address these issues? of access and ensuring that people get care where and when they need it, and that when they do, they know it's safe, effective, and appropriate, while enabling clinicians to do more good for more people. So with the pandemic, what we found was something we all knew, and if you had been even vaguely familiar with healthcare in the 90s even, you would have seen the Dartmouth Atlas that showed the variation that occurs. Your geography is your healthcare destiny, which is fundamentally wrong. And what happened during the pandemic is, while there have been lots of studies that have been published about, uneven and basically racism in healthcare, a lot of it, that what happened was that it was elevated to a national conversation in a way that it hasn't been before. And so our work has really focused on convening under the leadership of 3 co-chairs, Christy Henderson, who is an executive with Optum and the chair-elect of the ATA board, Yasmin Winkler, who is a phenomenal managed care leader and recently retired from United and got some recent award from the Latina Professional Association, and then Ron Wyatt, who is a physician who's really studied and written extensively about racism in healthcare. So those were our 3 co-chairs, and we convened a group of about 35 individuals who represent an incredible spectrum of folks, not just in our healthcare delivery system, but in community work as well. And they've come together and have been meeting regularly. And the first piece of work that they've released or that they've completed is going to come out on the 26th of October.
Okay.
And that's a briefing that talks about, it demonstrates through a pyramid, if you will, what are the different levers that we have to pull in order to address inequity and disparities, and what do we have to do to eliminate them. And what's fun is that what they've said is the notion of connectivity, broadband, which we talk about a lot, is actually just the tip of the iceberg. And in some areas may be very easy to solve. Easy is the wrong word, but it's pretty straightforward.
Right.
But once you get past the connectivity, then you have the affordability. And what I mean by that is the affordability of the data plan. If you are seeking mental health services on your smartphone and you have a data plan with limits, it's not going to do you a lot of good if you run up your limits.
Right.
Or the affordability of the device itself, or even having access to a device, some mechanism for this. So that was the second layer. And then the third was this notion of literacy. We talk about health literacy, digital, technical literacy. Those were another lever that have to be pulled. And again, if you think about it, telehealth and the ability to really educate people and help them in that moment of creating a better user experience, for example, is something that we can do quite readily. So there's a lever to be played there. And then, the whole notion of competency and the ability for clinicians to really engage people in a different medium, a different modality than they have before. And then there's the whole level of, bias and structural components that we think are really important. So that is going to be a phenomenal piece of work. And the group has agreed to continue meeting and working over the course of the year until next Telehealth Awareness Week in 2022. Very excited about what they're doing and how they're approaching this.
Oh my gosh, that is absolutely fabulous. I can't wait to read it and see it and hear more about it. Where do you see that group going? Like, where do you see it plugging into the future of the ATA?
Well, a couple of ways. Number one is that at the ATA, we think it's really important to create and collaborate as much as possible. We know we don't have all the answers. So we have really fantastic folks from different delivery systems, community organizations, Easter Seals participating in it, just a number of different folks. And I think the next piece of work that they're going to do is looking at broadband and connectivity and mapping out counties in the U.S. and looking at different indices of distress or health or number of different factors. Because we know from preliminary work that we've looked at that there are a number of counties where there is great broadband and connectivity, but people aren't accessing. And therefore, what you're seeing is poor outcomes or poor health. But we also know that there are communities with great connectivity that, it's like, if it's poor connectivity and great outcomes. So there are levers that have to be played there. And so the idea here with the map is to really target specific areas and specific interventions. It could be a community organization, it could be the church, it could be any number of different vehicles. And it may point to more training or understanding on the part of clinicians and how they might outreach communities. So that's going to be another big step. And then the whole idea of how you create the economic case for eliminating disparities. We know that there's an economic case for diversification, for example, in corporate boards or in management, senior management teams of companies that have diversified management teams, women, people of color, actually do better financially.
Yes, yeah.
And so we have to craft that message for the healthcare community as well. So it's not about ROI, it's beyond ROI.
Well, and ROI takes on a much more depth in that conversation.
Right,
so,
it's dollars and cents with an SEN.
Yes, exactly.
Yeah.
So you've got a few core initiatives coming up that I want to give you a chance to talk about. There's the EDGE conference coming in December. And then, of course, the ATA conference next May. What are your hopes, dreams, goals for each of those?
So we provide value to our members in a couple of different ways. The first is policy and advocacy work. The second is in convening members in different discussion groups or special interest groups. And the third is with our signature events that you just referenced. So EDGE is going to be December 6th through 8th in DC at the Watergate, which is the scene of the crime many, many years ago. And the conversation there is, what do we do now? Because we expect that, there may not be a resolution of what happens with the waivers and the relaxation and the ability to do things more freely than we have in the past. And so there'll be a lot of conversation and discussion and action plans around that. So that's what comes out of EDGE. And then we have ATA 2022, which will be May 1st through 3rd in Boston, the same site of health at the Boston Convention and Expo Center, will be another, again, it's going to be a phenomenal convening. And what we noticed at Health was all the energy and excitement about being back together.
Yes,
so
it's palpable.
It's really palpable, and we think that where Health does such an amazing job of convening a lot of folks, especially around innovation, our sweet spot is going to be around virtual care and really convening that community and getting folks together and probably building in a lot more time and space for them to network and just catch up with each other personally. So we're very much looking forward to that.
Well, we are too.
Good.
My last question for you, which I like to ask people like yourself, is if you dream about what the future of virtual care looks like, paint me the picture.
Well, it's wonderful because in many ways the picture has been painted for us, right?
Yeah.
This idea of meeting people where they are and recognizing that you can get health, and not just health care, but health broadly through different modalities. People have had a taste of that. They've seen, United put together a video many years ago that showed how somebody would receive services in the future. And it would be, a combination of remote monitoring that didn't require you to do anything. So we learned from Kindle that when you order a Kindle online, it comes to your house, you turn it on, it works. So the lesson for healthcare is, if you want someone to do something, don't make them do it.
Right.
So that is part of the future. But I think the other thing that we're recognizing is that telehealth and virtual is not just for the occasional, crisis or acute incident. It's really a mechanism for closing gaps of care, for making people stay safe in their home or wherever it is they want to be. and to really ensure that we're doing a better job of keeping people, getting them healthy and keeping them healthy, and for them to be very engaged in that process.
I love that. That's a fabulous future.
I'm all in it.
Me too. Well, thank you so much for joining us today.
You are so welcome. It was a pleasure. Thank you.
Excellent.